Dear friends, the third episode of the Med Study Notes is just on air. We dedicate this edition to all our teachers on the Teachers' Day. We recognize their contribution in making us what we are today. Our respectful greetings. We take this opportunity to thank all our viewers for their tremendous encouragement offered to the first and the second edition of Med Study Notes. Hello friends, here we are together for the next episode of Med Study Notes. If you are new to the channel, please hit the subscribe button and the bell icon to get the upcoming videos. If you haven't checked the old videos or the previous videos, please check the channel or the video playlist. Let's get into the topic. Disease of the eyelid. Let's look into common diseases of the eyelids. The common diseases of the eyelids are blepharitis, blepharospasm, blepharoptosis, or it is also known as ptosis, coloboma, dermatochalasis, Ectropion, Entropion, facial palsy, Stye and Trichiasis. Now let's look into the first disease, which is the blepharitis. Blepharitis is an inflammation of the eyelid. It usually affects both eyes along the side of the eyelids. It commonly occurs when tiny oil glands near the base of the eyelashes become clogged, which causes irritation and redness. Several diseases and conditions can cause blepharitis and is often a chronic condition. It is difficult to treat. It can be uncomfortable and unsightly, but it usually does not cause permanent damage to the eyesight. It is not contagious. It is classified into three types, that is squamous blepharitis, ulcerative or bacterial blepharitis, and meibomitis or posterior blepharitis. The signs and symptoms of blepharitis, which becomes typically worse in the morning. The signs and the symptoms include watery eyes, red eyes, a gritty or burning or stinging sensation in the eyes, and the eyelids appear greasy, itchy eyelids, red swollen eyelids. There will be flaking of the skin around the eyes, crusted eyelashes, eyelids sticking. The people who have blepharitis will be frequently blinking their eyes. They will have sensitivity to light, and the vision of these people will be blurred, and that the vision improves by blinking. Now comes the first type of blepharitis, that is the squamous blepharitis. It is usually associated with dandruff. Glands of these secrete abnormally excessive neutral lipids, which are split into free fatty acids by corynebacteria. It is manifested as whitish, soft scales accumulated around the lid margins. Ulcerative blepharitis. It is caused by staphylococcal infection of the lid margin and is characterized by yellow crust at the root of cilia that bleed when removed. Anterior lid margins show dilated blood vessels, which is known as rosettes. Commonly observed complications include recurrent stye and conjunctivitis, and marginal keratitis, madarosis, poliosis, tylosis, and eversion of punctum. Posterior blepharitis, also known as meibomitis, it is caused by a meibomian gland dysfunction and seen more commonly in patients with acne rosacea, seborrheic dermatitis, which is also known as dandruff. Form in the tears is a characteristic symptom. Blepharospasm. Blepharospasm is a type of focal dystonia in which there is involuntary contraction of the muscle of the eyelids, causing closure of the eyelids. This does not have any effect on a person's vision or mental faculties. The only time the vision would be affected is when the contraction becomes so extreme, which forces the eyelids closed. Symptoms include frequent blinking and irritation of the eye. Dry eye has also been noted to be present with blepharospasm. The cause is unknown, though patients should be evaluated for the disease that may have blepharospasm as a symptom. Treatment includes three areas of focus, which is by oral medication or botulinum toxin injection into the orbicularis muscle and facial denervation. They can be used separately or in combination with the others to provide the best treatment. We will continue in the next episode.